At first, Jill Cowan thought Max getting quieter was part of being a teenager. It wasn't.
When he first told me that he was struggling with depression, I did ask him if he ever had thoughts of hurting himself. And he didn't say anything. And he just sort of had some quiet tears fall.
Hey guys and girls of the universe and beyond, Max is back here and just wanted to tell you guys
Cowan's son Max was doing well in school, had a long-term girlfriend, and a group of friends. When he told her he needed help, she contacted her family doctor for a referral to a psychiatrist.
Within maybe a week of Max telling me, so pretty quickly, I got that first appointment scheduled.
When was his first appointment then with the psychiatrist or psychologist?
That never happened. He died before he was able to get that first appointment.
He was 16. The football player, taking courses for extra credit, had a hard time getting out of bed. A vacation and then medication didn't provide the relief the family sought.
I made a pact with Max. If you ever had those thoughts of harming yourself, all you would have to do is come and touch my arm and I would know. That's our signal. We would go to the hospital.
In the weeks and days leading up to his death, he secured a tryout with an elite soccer division and celebrated a birthday with his girlfriend.
He had died at some point in the early hour morning. And 2 weeks later, we got a letter in the mail saying he had been accepted as a patient at Child and Youth Psychiatry. 2 weeks after his funeral.
Do some of them get better before they get seen? Yes. Do some of them not get better before they get seen? Absolutely. Do some of them precipitate care by attempting suicide and ending up in hospital? Yes.
Dr. Marlis Misfeld knows how hard it is to get a patient an appointment with a psychiatrist. A Saskatoon family doctor says the provincial healthcare system failed her patient after it canceled a psychiatric referral.
The system is broken if someone...
Global News first spoke to Misfeld in March 2021. She had referred a patient suffering severe anxiety and depression to a psychiatrist for further help, but the psychiatrist wouldn't accept the patient. Misfeld received a letter stating a specialist decided a referral is not required and canceled it. That patient finally did see a psychiatrist about 5 months later, but others are waiting much longer. Misfeld, a family physician in Saskatoon, says patients usually wait 9 months to a year for psychiatric help. She now only refers the most serious cases.
I'm keeping them safe and looking after their medications that they were prescribed when they left hospital, or managing them. But do I think I'm doing the best job that I can? Yes. Do I think I'm necessarily the right answer for them? No.
Psychiatrists in the city use a pooled referral system, wherein patients are directed to the doctor with the shortest wait time. Many other medical professions use the same method, but Misfeld says no one waits as long as those needing mental health treatment.
It would be like a severe heart patient, right? They have a severe coronary arrest. Their heart almost died. They've got damage in their heart. And they get sent home from hospital and said, just follow up and don't, someday your cardiologist may contact you whenever they get around to it.
Cowan was diagnosed faster than her son was.
I went for a routine mammogram and they found a concerning entity, and 2 weeks later I was in the breast health center. I had a biopsy done. I had the number of a nurse I could call 24 hours a day. A month later, I was in the hospital scheduled for surgery.
Even knowing you will see a specialist, Misfeld says, is critical.
I think that knowing that you have that appointment set up gives you that hope that you can get better.
Cowan and Misfeld are both in Saskatoon, the province's largest city with 3 hospitals and many clinics. It's different when there's nothing to wait for. Jacelynn Charles was 15 when she died by suicide. Her mother, Veronique McCollum, remembers their last conversation.
They got picked up around 10 that morning, so when they were walking out, she was about to walk out, so I went running to her and I held on to her and I said, "No, you're not leaving me." And then she just looked at me with a surprised face and she thought I was serious, and then I laughed. "I'm just kidding. I love you with all my heart."
Jacelynn was living in Pelican Narrows, about 550 kilometers north of Saskatoon, when she died. McCollum says she struggled with her own mental health, as well as addictions, during her life, so she knows it's hard to access help in the north.
The only time she's seen the doctors was when she was in the psych ward. I don't think there's that much mental health places that are reserved.
Jacelynn was in a psych ward in Prince Albert for about a week, her mother says. After she got out, McCollum tried to get her more help.
I did try to make an appointment with my daughter after she got out of the psych ward, but they gave me her time, and her appointment, I think, was 4 months later.
A 2019 Stats Canada report shows suicide rates are far higher among Indigenous people than non-Indigenous people. It's twice as high among Métis, about 3 times as high among First Nations, and nearly 9 times as high among Inuit. The report says intergenerational trauma is associated with suicidal thoughts and attempts, along with other factors like food insecurity. But if you isolate the impact of the negative effects from things like low household income and marital status, the suicide rate for Indigenous people drops very close to that of non-Indigenous people. These are the numbers for First Nations.
The lazy interpretation is always that Indigenous people are more at risk for suicide, but there's nothing about being Indigenous that makes you more at risk.
Dr. Tyler Black studies suicide and works to prevent it.
If your system is based around the most urgent or the most in-need people, you're basically spending the least efficient way of helping people.
Early intervention, he says, is key. The longer a small issue remains, the more difficult it can be to treat it later. But that requires more care.
Having more psychiatrists would be helpful. But there are a lot of counselors, and we need to make sure that they're given the best tools to be able to support the most amount of people. Psychologists currently are only accessible in most schemes in Canada via private insurance.
Mental Health and Addictions Minister Everett Hindley says the province is working to retain and bring in more workers.
In addition to hiring and training more healthcare professionals in these fields, that we also enhance their access to them through options such as virtual care.
Global News also asked the Ministry of Health and SHA about the psychiatrist pool and about improving access to mental health care in the North and for Indigenous people. A spokesperson said the average wait time for the pool system is about 4.5 months. In 2020, McCollum took part in the Walking with Our Angels protest, which demanded the Saskatchewan government do more to prevent suicide. She has another walk planned for this summer. Cowan started Healing to the Max, a support group.
There was a couple of really profound things that I struggled with upon realizing my son had died. And one of them was the realization that this was going to keep happening. And it has. And that I would not be the only mother who would be feeling this way.
Both Cowan and McCollum say they'll keep struggling to help others who are struggling.